Assalamualaikum warahmatullahi wabarakatuh. Very good day to everyone. Thank you, Chairperson and the organizing committee for allowing us to share our experience during the COVID pandemic. What have we learned? These are the three main topics that I wish to cover, looking into the initiatives, the challenges faced, and the moving forward action. On the 12th March 2020, the World Health Organization has declared the COVID-19 as pandemic, and 6 days later, the Malaysian government has ordered the movement control order. And this has led to reorganization of many services, including the healthcare facilities. And we in the campus Kuala Lumpur, we were directly affected as well. The Hospital Chancellor Tuanku Mukris, or known as Hospital UKM before this, were affected. And later the Hospital Pakar Kanak-Kanak, or known as Hospital Tuanku Ampuan Besar Tuanku Aisyah Rohani, was also affected, and the Faculty of Medicine of UKM at large. As early as 8 January 2020, the Hospital Chancellor Tuanku Mukris has taken a very proactive action in having the response committee, the ACTM COVID-19 response committee, led by the hospital director, and the other members include the occupational safety and health officer, family physician, internal physician, anesthesiologist, pediatrician, ONG specialist, secretaries, as well as the professionals from the nursing department, lab and diagnostic department, as well as the security officers. And the main task of this response committee is to look into the facilities, equipment, and human resource in preparation for the COVID outbreak. As early as 30th March 2020, HCTM has started its function as the COVID-19 hospital, and we received quite a number of cases from that onward. However, from 4th June 2021, we had to sort of bring our sister, the HPKK, the Hospital Pakar Kanak-Kanak, to also directly involve in the COVID management due to the upsurge of the COVID cases. So under the management, we've got the infectious disease physician, we've got the public health physician, the infectious control unit, the safety and health officer, as well as the secretaries who are directly involved in terms of looking into the cases, as well as the support and civilian process to control the infection involving our staffs. And the COVID-19 ACTM operational room was initiated on the 17th March 2020. The challenge with this unit, because there was no clear term of reference, as this unit was just being introduced or being initiated during the pandemic, and everything was so new and foreign, including the terminology use. And there was a need to do frequent revisions of the standard guidelines used in the hospital according to the new emerging evidence. And it's very important for the coordinator or the director to adapt very fast and be agile, making a correct decision. And the unit also need human resource, need members. And this also led to mobilization of staff from the infectious control unit, public health and family medicine departments. The main task of this COVID-19 HCTM operational room is to focus on minimizing the risk of infection to staffs and public, as well as the HCTM visitors. The operational room or the unit involved mainly looking into the case detection, health promotion, hotline, providing hotline to do contact tracing and surveillance. This operational room worked together with the Ministry of Health, particularly the District Health Office of Cheras and Hulangat, and Crisis Preparedness and Response Center of the Ministry of Health. And in order to prevent to control the infection in the hospital, it is very, very important for the patients to be triaged to separate those with COVID or at risk to have COVID infection from the patient without risk of COVID infection or without a COVID infection. So accident and emergency department played very important role in that. So they have this triaging process where patients were categorized into 3 main groups: patient under investigation or having COVID infection, and then Zone A focus on those with symptoms suggestive of COVID but had no contact with COVID infected person or had no history of recent travel. And Zone B was dedicated to patients with no COVID related symptoms or categorized as low risk. And these patients were managed accordingly, either to be admitted to the hospital or to be discharged for surveillance and follow-up. And under HCTM, we have our primary care service, and the clinic is located about 5 minutes drive from the campus, and it is in the commercial building. So as a result of the movement control order, so we had to reorganize our service. So stable cases, stable chronic patients, such as those with diabetes mellitus, hypertension, they were given longer follow-up, and a patient were informed on the changes in the appointment dates through phone calls. And we also make posters that were being distributed through the social media, as well as put up in our web, informing them about the new changes. And patients were given longer medication supply. Before the COVID, patients were given a monthly medication supply, but due to the restriction of the movement, patients were supplied with medication up to 3 months supply. And acute cases were managed accordingly at the clinic. The challenge with us, due to its location in the commercialized building, we did not do any swab procedure, and but we managed to have a special room for patient under investigation, and quite a number of cases were managed using that room. And during the COVID pandemic, we had quite a number of medical officers, but due to the shrinkage of the service, so we had actually deployed our medical officers, including the postgraduates as well as the staff, to help support the hospitals. So our staffs and doctors were deployed to work in the COVID-19 wards, to work in the HCTM operational room, to help service at the vaccine center, as well as to help service at the COVID assessment center conducted by the health centers nearby. As for the hospital management, all the patients who are stable, similar as the primary care clinics, they were given longer follow-up. And for the inpatient management, the focus were mainly for critical care. And operation theaters were focusing on emergency cases, elective cases, and stable cases were put on queue. In addition to that, during the upsurge of the COVID pandemic, mainly from June to August or September 2021, the non-critical wards were converted to the COVID-19 wards to cater for the high number of COVID cases. And for the pharmacy, we also offer an additional service on top of the usual service where patients can take their medication at the pharmacy of the hospital. But during the COVID pandemic, patients had an options either to collect their medication through the drive-through service, or they can request their medication to be posted to their home. And in order to control the infection as well, we have the screening procedure at the main entrance. And what the visitors or public need to do, they need to have the temperature check and to update their MySejahtera status, and our staff would check on their status, and they had to fill in the health declaration form to re-stratify them in terms of the COVID infection. And no doubt this has led to long queue during the process. And I will share later how we use technologies to reduce this long queue. And as we know, the COVID infection leads to risk of having similar infection or exposing our staff to the infection. Apart from advising our staff to properly look after themselves, doing the self-care and minimize the exposure to the COVID-19 infection, we also provide a standard guidelines on how they need to operate at workplace, and the staffs were provided with personal protective equipment according to their place where they work at. Some areas, they may just need the aprons and masks, while some areas, they may need the goggle, gown, gloves, and shoe cover, for example. And all these staff were trained on the gowning and doffing, and this training were conducted as early as in January and regularly after that. And in terms of human resource, we reduced the number of staffs at the campus to the very minimum, and we allowed the faculty staff to work from home, and we created a spatial rosters for the hospital staff, keeping the number to the very minimum, yet still functional. And we also mobilized the staff from the non-critical service to help their colleagues in the critical service, such as COVID wards. For the medical equipment that was handled by Central Sterile Service Department, the main aim is to ensure the medical equipments are sterilized and disinfected according to the standard protocol, and it is safe to be used in the hospital. In January 2021, we started the vaccination program to our staffs and clinical students, and is compulsory for the staff to take the vaccine. Those who did not complete or refuse to take were not allowed to work. In addition to the vaccination program targeted to the staffs and students, we also offer the vaccination program to the public. So in March 2021, we helped the government with the National COVID-19 Immunization Program through the drive-through vaccination service conducted at the car park of the HPKK. And we also have the mobile vaccination team that went out and cover all the areas that is difficult to reach out. And the faculty also was active in terms of educating the public, and this public education was taken up at all levels, including the administrators. And as you can see in the poster, that our Pro Vice Chancellor, Dr. Hanifia, was actively talking and educating the public in relation to COVID. And in my department, we also at least involved in two or conducted two webinars. The first one is about COVID and vaccine debunking all the myth. And the second one, we conducted COVID-19, just a general information and education modules to help the adolescents and school children. All this public education were made through TV, radio, social media, using posters and flyers as well. And we are proud to share that following this initiative, we help to educate Malaysian public at large in terms of increasing their awareness and understanding on the gravity of the infection. As for the faculty, all the teaching activities were conducted online, and the tricky part as a result of this, it reduces the clinical exposure or clinical contact to the clinical students, such as the medical and nursing students. And this definitely, no doubt, had affected their clinical experience and skills. So one of the ways that we use during the COVID pandemic was creating videos, teaching them about the clinical skills shared in the YouTube or our own local platform. And in addition, students were encouraged to practice on their family members and friends to record the skills that they perform, and we would discuss during the class. And as a result of this lack of clinical exposure, the clinical exam were postponed until safer dates. Research activities were kept to the very minimum. Only essential lab services were continued, such as the tissue culture, and many of the activities were converted online, including the online surveys as well as qualitative interviews. Staffs, as I mentioned, especially the faculty staff, were allowed to work from home. They were allowed to take office work, accept confidential or secret documents, and in order to monitor their activities, they need to make a daily report on their activities and to be sent to the HR on regular basis. No doubt, COVID-19 infection led to anxiety, fear of the unknown, created false alarm and fake news. And the Health Promotion and Risk Communication Unit has tackled this issue wonderfully. This unit was headed by the public health specialist. The main function of this unit is to ensure correct information being disseminated to the staff through posters, infographic, and videos. They made internal circulation using the social media platforms such as Facebook, Instagram, and WhatsApp, as well as emails and hotline. In addition to that, the campus also has psychosocial support service, not only to reduce the anxiety or related stress from the COVID infection, it also helps with those with burnout and stress, especially those who are working directly with the COVID cases. And this psychosocial support was provided by psychiatric department. In terms of infection control, we have the swab team centralized at the hospital, and we also have swab team at the individual department level. The function of this swab team at the individual department level, apart from doing or performing the swab to the department members among those who are symptomatic or having risk of having the infection, such as close contact, the swab team unit also responsible to do the notification as well as doing the risk assessment and monitor all the COVID cases as well as suspected cases. It is the responsibility of the swab team to liaise with the ACTM to inform in terms of the cases, as well as to work with the operational room for surveillance purpose. And no doubt, all these activities incur costs. There's increased costing for the medical equipment, for example, in terms of personal protective equipment, the need for extra ventilators, oxygen concentrators, as well as extra portable monitors. And these need a swift action for item procurement or special budget. And we're lucky in terms of we have an additional funding from the Ministry of Higher Education during the pandemic, and all staffs were given extra allowance during the pandemic, especially those who were directly involved in managing COVID cases. In addition, we also have the donation drives conducted or provided by the individuals, the non-government organizations, companies, corporate bodies, as well as the alumni. So the donation involves not only in terms of the money, they also provide us with the equipments as well as the personal protective equipments and food for the frontliners. And as the COVID-19 continued until 2021, no doubt it affected the economy of the country, and it also affected our staff, some of the staff, especially those spouse who are working not with the government. There are some of them lost their work or job. So we created a food bank, which is an individual initiative. The first one was a program Kasih by the Quality Department, and another one is a project Almari Putih by our department, the Clinic Primer. So this food bank is open for the staffs or students as well as patients. They are free to take any items from the food bank with no question. Now, I just would like to share the innovation and technologies that we had during the COVID-19 pandemic. As I mentioned, when we did the screening at the hospital entrance, led to the long queue due to the manual screening process, and the use of QR code as well as the digital thermal screening had actually improved or shortened the long queue. And the advantage will definitely to those who are IT or smartphone illiterate, especially in using the QR code. Anyway, we still have our staff rostered there to tackle or to attend to patients or public who are not able to use the QR code or the online forms, for example. And during the COVID pandemic, with the collaborative efforts with the respective ministries, industries, we have at least 4 robots being introduced or being built during the pandemic. The first one is robot MCK-19 or robot Makcik Kia 19. So this robot, which has racks, it able to hold loads of up to 300 kilograms. It can be navigated independently. It helps to deliver food or medicine to patients who are in the hospital. And the second robot is called Pak Saleh. It's an automatic disinfection robot. It holds the spraying cleaning materials, and the function is to sort of disinfect the hospital areas. So over 2 weeks with 2 liters of disinfectant, the robot managed to cover at least 10,000 meters of areas. The third one is the robot Vita. So again, this robot Vita is remotely controlled, and the beauty is this robot managed to detect obstacle in front of it, so it will avoid any obstacle in front of it. The function of this robot Vita is to help in the COVID-19 patient management or monitoring. So, and the last one is robot UKM, which has dual arm robot system, and the main aim of this robot UKM is to do the swab test. And all these robots, definitely it has all these 4 robots that I've mentioned, the Makcik Kia, Pak Saleh, Robot Vita, and the robot UKM has minimized the use of human in dealing with all this process. It reduces the risk of infection to people, and it also reduces the number of PPE used during the process. In short, COVID-19 is has been with us for more than 2 years, and now we are in the endemic state. And the faculty has helped the country in terms of managing the COVID-19 cases. We had help in the national COVID-19 immunization program, as well as giving the education to the public. The way forward, based on the experience that we had, we are more prepared for a similar challenge in the future, inshallah. With a good teamwork, competent leaders, efficient human resource management, and stable financial resources, this would be possible. Good communication and dissemination of information to staff and public is essential, and good understanding and commitment from employees, students, research, and public are also equally important to do for that. And smart partnership with collaborators, especially during our Industrial Revolution 5.0, the use of robotics has actually helped us along the process. With that, I thank you.